Now, how does our knowledge of the mutational profile of a thyroid neoplasm aid in diagnosis? You may be surprised to know that for me, as a surgical pathologist or a cytopathologist, generally speaking, it's not terribly helpful, or I don't really need that information to know what the underlying mutational profile is of a thyroid tumor in order to render a diagnosis. For the most part, our diagnoses are rendered based on what we see under the microscope. So they're morphology based in the vast number of cases, both on the surgical pathology side of things and on the cytology side of things. We're going to classify things mostly based on what we see under the microscope. In those challenging cases where we're struggling to make a distinction, say between a medullary carcinoma and a follicularly derived neoplasm, we're going to use ancillary studies like immunohistochemical stains that are largely phenotypically based. So we would say look for calcitonin expression if we're trying to identify a medullary carcinoma versus thyroglobulin expression if we're looking for a follicular-derived neoplasm. But the mutations do come into play significantly on the cytology side of things.